Hello, in this video, I will be talking about pregnancy after breast cancer and its treatment. You may want to check out our other video we have on pregnancy during breast cancer diagnosis and treatment. Before I go on, I'd love to invite you to subscribe to our channel. We put out content several times a week, so there's always something new to watch and something new to share with other people in your life. So first I'm going to address the question of safety of pregnancy after breast cancer. For a long time, it was thought that getting pregnant after breast cancer could increase the risk of recurrence because early on in pregnancy, reproductive hormones go very high. But it turns out, and there are many, many studies indicating that it is not unsafe to have a baby, get pregnant and have a baby after breast cancer treatment. There does not appear to be an increase in the risk of breast cancer recurrence in people who are pregnant. Now, there are some considerations. One is that some treatments for breast cancer can decrease the ability to become pregnant. So chemotherapy can put somebody into menopause earlier. It can cause a cessation of periods, the periods to stop for a little while, so there may be some uncertainty about whether or not somebody can get pregnant. If their periods, which were regular, now stop, there's some blood tests and other things that can be done to help determine whether or not you can conceive and carry a pregnancy after breast cancer. It's important for people on endocrine therapy like tamoxifen not to be nursing or pregnant while on tamoxifen. So one of the things we recommend is that tamoxifen be stopped for about a month at a minimum before somebody tries to get pregnant. What about the timing of pregnancy after breast cancer and its treatment? Well, there's no hard science to this, but the general recommendation that you'll be offered is to wait until 2 years after the completion of breast cancer chemotherapy and to wait until after endocrine therapy's been going on for a couple years. The hope is that the window for early recurrence has passed and that the conditional survival without a recurrence is increased after the first couple of years. But for some people, that window may feel too long. If you are about to embark upon breast cancer treatment, this is a good time to check out our video on fertility preservation during breast cancer and its treatment, because it is possible to harvest ova, the eggs, before starting chemotherapy, which can help with that sense of urgency afterwards. So we've talked about the safety of getting pregnant and having a baby, the timing being a couple years, although for some people that's not acceptable, and you'll want to weigh the risk of recurrence. For example, people with ductal carcinoma in situ are not at risk of systemic recurrence, so that waiting period is really not relevant. But for people with invasive disease, that 2-year recommendation is just what we call conventional wisdom. It's just sort of a general guideline or rule of thumb. If you become pregnant after breast cancer treatment, you won't be on your endocrine therapy during the duration of your pregnancy. We also don't recommend maintenance, targeted therapy, or other drugs that continue for a year after all of your treatment is over. So you might think, well, I'm done with treatment. I'm just on trastuzumab, HER2-directed therapy, or just on a PARP inhibitor. But we don't recommend giving those during pregnancy because of the risk to the baby. What about pregnancy outcomes after breast cancer? While there is some evidence of a higher risk of preterm birth and lower weight babies, most studies actually don't support that. Most of the studies suggest normal outcomes for the baby in terms of weight. There's no increase in the risk of birth defects with the exception of the risk on tamoxifen. So in terms of the outcome, there should be no concerns. What we do recommend, what you may be offered, is seeing a specialist in high-risk pregnancies. Though again, if that's not offered, there really is no need for concern if your treatment is all complete. It's so wonderful to think about family building, and it's so not wonderful to think about breast cancer. So one of the other things that people really struggle with is the creativity of having a family versus the grief and loss and residual effects of having had breast cancer and its treatment. So if you're still struggling with chemotherapy-related fatigue or sleep problems, thinking about building a family may be something really difficult for you. And if you've decided not to build a family after breast cancer, that's okay too. It's really important, of course, that your whole life be considered, that every part of you be considered when you make a decision whether or not to have a child or another child. And for those of you who are not able to get pregnant, of course, there can be some grief and loss around that too. So this isn't just a happy time. I think it's important to acknowledge there are a whole host of feelings that enter into the mix. I hope this has been helpful to you. Please drop a comment or question below about your experiences. Any questions you have, we try to get back to you within a week or so. And as always, you can follow us on Instagram, and thank you for watching.